Today I'm going to talk to you about running with IT band syndrome. The IT band is a wide, flat ligament-like structure that runs down the side of the hip to the kneecap, to the shin bone, and part of the hamstrings. In the case of IT band syndrome during running, the pain is often felt on the outside of the knee. The pain may shoot up the outer side of the back of the thigh up toward the hips. That is one of the most common symptoms of running-related IT band syndrome. In this video, I'm going to provide tips to consider to avoid worsening the condition if you are a stubborn runner who runs with injuries and runs through injuries. Many runners are actually like that. In many cases, when it comes to running related IT band syndrome, you can run with IT band syndrome. You just need to be very mindful of a few things. And of course, it wouldn't hurt to scale back your running mileage for if you choose not to rest. Digging deeper into the scientific research on running-related IT band syndrome, many experts describe the IT band as being an incredibly durable structure with having very similar durability to that of a car tire. So with that said, you would really have to be doing a lot of strenuous, hardcore running to really erode away at the IT band itself that would result in an injurious assault directly on the IT band. In that spirit, many researchers have highlighted a potential official reason for running-related IT band syndrome, and that many researchers believe that IT band syndrome may not be the result of an injury to the IT band itself, but the pain that radiates from the outer side of the knee up the outer side of the thigh during running may be the result of IT band itself compressing on a fat pad that lies beneath the IT band on the outer side of the knee. On that note, if you run in a way that causes the IT band to constantly aggressively press down on the fat pad beneath the IT band, it may harvest a lot of friction, irritation, and painful inflammation on the fat pad. And this compression of the IT band on the fat pad may transcend pain on the outer knee during running. So what would be some of the irregular mechanical movements during running that you would be doing that would account for the repetitive compression caused by the IT band on the fat pad of the outer knee? Researchers have poised the idea that running with a narrow step width or a crossover running gait. So in a crossover running gait involves the feet landing on the midline. Your feet are landing on a straight line. Running with a crossover footstep pattern could amplify or intensify the compression on the fat pad by the IT band. In this case, you may need to make adjustments in your legs' positional alignment when you run to remove pressure from stacking on top of the fat pad on the outer side of the knee joint. Experts urge that possibly widening your step width during running may be a strategically relevant therapeutic approach to systematically remove a lot of pressure, not only from the outer knee, but may relieve a lot of pressure from the lower leg as well, as running with a slightly wider step width has been linked to shin splints pain relief in runners. So a wider step width during running would look like this. A wider step width would involve the feet landing a little bit further away from the midline, whereas a narrow step width or a crossover running pattern is when the feet land sort of on a straight line directly on the midline. So in the case of IT band syndrome, you want to aim for having a little bit of a wider step width, so the feet land further apart from each other when you run instead of landing closer together. So the feet land a little away from the midline. Therefore, widening your step width during running may be a necessary mechanical adjustment that may remove an enormous amount of pressure from the outer knee and may therefore improve your rate of progress with respects to improving your IT band syndrome symptoms. Other reports have also highlighted additional general roadblocks that may slow IT band syndrome recovery. Additional IT band syndrome causing conditions may include running on a slanted road or a slanted surface, running on a track in the same direction because the turns on the track may further streamline more pressurized pain on the fat pad from the IT band. Too much downhill running because it may exhaust the quads, whereby fatigue quads during downhill running may compromise knee joint stability during running and may result in more friction from the IT band on the fat pad of the outer knee. And of course, running with an excessive crossover running footstep pattern. So according to a growing body of evidence, running with just a slightly wider step width may be mechanically more defensible at strengthening the position of your lower legs in a way that may reduce the tendency of the IT band from repetitively compressing the fat pad on the outer knee. Furthermore, there is a leading idea that holds that landing with a forefoot strike landing pattern during running, especially when you run barefoot, because barefoot running helps prevent your forefoot strike from being misplaced. Forefoot running may aid in naturally widening your step width because your foot tends to land under the hips, more away from the midline, as there is less time for the leg to fully swing out ahead of the body and follow through to landing on the midline. In contrast, if you heel strike when you run, you may have a longer stride where the leg may fully extend way out in front of the body. And if you have weak hip muscles, this may increase your chances of causing your foot to land and settle down on the midline, which would give you a narrow step width. But if you land with a forefoot strike landing pattern during running, landing on the front part of your foot seems to stop your foot from swinging out too far ahead of the body and may naturally help align the foot to land more under the hip, more away from the midline. Now, I only suggest widening your step width if you have IT band syndrome. If you don't change anything in your mechanics. But if you have been struggling with IT band syndrome for a very long time and have tried everything, but nothing has worked, try landing with your feet a little wider apart from each other when you run and see if that helps. Implementing a wider step width during running is actually meant to help runners with IT band syndrome to help potentially fix the problem faster. That is because, as I just illustrated, running with a crossover or very narrow step width landing pattern of the feet is a posture with the potential unfortunate implications that may potentially increase mechanical stress on the outer part of the knee. So again, if you have IT band syndrome, when you run, try to be more self-aware of how far your feet are landing away from each other and how far your foot lands away from the midline, and give priority to getting your foot to land just a little further away from the midline. That is, of course, if you have IT band syndrome or throbbing outer knee pain and soreness when you run. For more information on forefoot running versus heel strike running, please visit my blog, runperfect.com, and please subscribe to my YouTube channel to stay updated on all the health benefits regarding barefoot running and minimalist running. Thank you so much for listening and watching. Have fun out there on the roads. Bye for now.